The period from colonization to the war played a large role in the development of social work. The social work in America has divided into following stages: the colonial period, Civil War and Industrial Revolution, industrialism, the human side, the social work seeking professional characteristics, highly professionalized discipline. Social welfare services have existed in America since the establishment of the original 13 colonies in the 17th and 18th centuries. The first almshouse was established in Massachusetts in 1662. It started functioning in 1685, both as an almshouse for the disabled and as a workhouse for the able-bodied paupers. These alms and workhouses also took care of the health problems. Most of the specialized and advanced general hospitals of America, like Bellevue Hospital in New York and Philadelphia General Hospital, were in the form of almshouses. The first hospital were for the poor with physical and mental ailments. For example, the Pennsylvania Hospital, completed in 1756, and also planned primarily to house the sick people admitted, the mentally ill who were confined in the cellars of the building. Sick endorse minor ecclesiastical functionaries whose duty was to visit these sick persons in their own homes were sent to the colony. The orphan masters were appointed to protect the interests and properties of widows and orphans. The first overseers went, were appointed in 1691 in the city of Sawston. The system of poor relief during the colonial period in America reflected the Elizabethan poor laws. The town, the smallest unit of the government like Paris, were responsible for its inhabitants. The primary motive of the town was to protect itself against the poor and destitute. It was not uncommon to auction the poor to neighboring farmers or to send them privately run almshouses. Another development during this period was the broadening of base of responsibility from town to the province of Massachusetts for a special category of poor. By 1701, there was a provision for the imbursement of to the town for the relief in all cases of unsettled dependent person ill with dangerous, infectious, and contagious diseases. The rapid growth of manufacturing industries after the Civil War intensified the complexities of social needs. People came in large number to the urban areas and they faced the problems like poor wages, poor housing, unemployment, etc. But on the other hand, a wealthy class of industrialists emerged with the stimulated voluntary relief efforts through their contributions to private charities. To solve the problems of social maladjustment of the cities and the labor classes, there developed a settlement movement that had a great influence on the evolving pattern of the social services. Beginning with the establishment of neighborhood guild, it was known as university settlement. In 1880, the movement spread rapidly through the larger industrial centers. The most important settlements were the Jane Addams Hull House in Chicago and Mary Skimcock Greenridge House in New York City. These settlement houses provided direct service for the people living in the neighborhood and were also concerned with the neighborhood planning and improvement. An early result of the settlement house movement was the development of a playground movement in American cities. By the last decades of 19th century, there are three important developments in the social welfare. The first one was the gradual recognition of the social needs of the people, particularly handicaps. Special institutions, both public and private, were developed for children and for the handicapped and for the mentally ill. Child labor legislation was enacted. A law was passed in 1913 in a connection to press the mill owners to have children in their factories, thought that 3 Rs. And Massachusetts passed a law in 1836 requiring the children under 15 working in factories attend school for 3 months in a year. In 1842, Both states adopted a law which established 10 hours a day as the maximum workday for children under 12 years. Children under 12 years were prohibited to work in textile factories. In 1797, Master legislature passed a bill holding that when it appears that a person is lunatic and so furiously mad so as to render it dangerous to peace and safety of good people, for such lunatic person to go at large, he may be committed to the house of corrections. The less serious and less dangerous were sent to the almshouses, mixed with paupers, children, and criminals. And the second important development was the assumption of greater responsibility by the states. When local units could not provide adequate relief for the special groups, the state government opened the first juvenile reformatory in New York in 1825. The first school of deaf was opened in 1870, and the first school for the blind was opened in Boston in 1830. Soon, other states also provided such facilities. Dorothy Linde Dix. Dorothy Linde Dix contributed greatly during the period for the recognition and needs of mentally handicapped people. She popularized institutional care and treatment for mental patients. The third important development was the emergence of private agencies. The people with humanitarian interests could not remain untouched from the experience of shock and agony to poor people living in urban slums. Many organizations and associations were founded for the welfare of people handicapped and sick. Around 1850, several maternity homes for unmarried mothers were established by various groups. The motivation for these programs were highly moralistic. YMCA movement were also started during this period. Next is Charity Organization Society. The Charity Organization Society, that is COS, were one of the important forerunners in the modern social work. They were first organized in London in 1869 as an attempt to eliminate discrimination, uh, an attempt to eliminate indiscriminate alms giving by the existing relief agencies and to organize the resources for the maximum benefit to the needy people. The Charity Organization Society movement was started in the US. The first charity organization society was organized in Buffalo in 1877. Later on, Boston, Philadelphia, and in New Haven had societies in 1878. The Charity Organization Society operated in the following four general principles. First one is the detailed investigation of the application, a central system of registration to avoid duplications, cooperation between various relief agencies, extensive use of voluntary friendly visitor. The main function of charity organization societies were in three folds. First and basic, the rehabilitation of families which for any reason fall to be self-sufficient. Second, the education of the community in correct principles of relief. And third is the aid to eliminate the causes of poverty. In the early effort of charity organization society, one sees the root of many present-day programs and practices. Among these are the social service exchange, the case conference, social action, and planning. The first social service exchange was organized by the Associated Charities of Boston in 1879. The objective of exchange was to serve as a clearing house in order to prevent duplication of services and to save the clients from the unnecessary investigation. The case of conferences method was applied, in which representatives of various agencies participated to share their views about a particular family and to discuss a possible plan of action. The social reforms were also made through COS in form of prevention of poverty. Watson pointed out that the outstanding characteristics was the emphasis placed by the charity organization society upon the prevention of poverty as reflected in various movements to change social conditions. In the report of the Committee on Organization of Charity in 1893, the chairman presented an impressive list of charity organization endeavors in the area of socialization, including housing, health, child labor, and sanitation. By the end of 19th century, the charity organization society began to employ paid workers. Many of the societies established training courses for the workers. The New York Charity Organization Society established the first school of training for social workers in the country in 1898. It was called as the New York School of Philanthropy, and now it is known as the New York School of Social Work, Columbia University. Charity organization, society, and settlement house movements were differed in certain ways. The social settlements never accepted the traditional idea that leadership has a divine right of the upper classes. At the same time, when the idea was widely prevalent, the social settlements set themselves firmly against attitude of condensation in the relation with the poor and sought to break down the undemocratic cleavage between social classes. The settlement could not cooperate with charity if it were nothing more than a relief society, but could operate with it if charity offered a friendship that could not change life. The settlement worked from within the charity organization society with its voluntary friendly visitors and paid agents was the force coming into outside to the neighborhood. Next is the beginning of social work education and the profession of social work. The trend towards the professionalization of social work has been best dated with the appointment of full-time staff to operate social welfare programs and the beginning of recognition of the need for volunteers who worked in such organizations. Mary Richmond could be considered as the first professional social worker in the United States of America. She became the assistant treasurer of Baltimore Church Charity Organization Society and later became a practitioner, teacher, and theoretician of the charity organization movement. In 1897, in the National Conference of Charities and the Corrections in Toronto, she advocated for the establishment of a training school for the professional social workers. In 1898, when Charity Organization Society of New York started training course for the prospective workers, Mary Richmond was appointed as one of the teachers. Later on, New York School of Philanthropy was created, which today is known as Columbia University School of Social Work. The other group of social workers were associated with the settlement house movement. Jane Addams, Florence Kelly, Edith, etc., felt that the legislation be made to improve working conditions and organization of neighborhood houses in slum areas to demand more amenities. This group focused mainly on the reform of the society as against the focus of charity organization society on the reform of individual and his family. The Chicago School of Civics and Philanthropy was established in 1901 and soon affiliated with the University of Chicago. It was it was thus first recognized that education for social work could be a part of general university education. The third school of social work was established The third school of social work was established at Simon's College in Boston. This school was the pioneer in the development of medical social work. Dr. Robert Cabot did pioneer work in relation with medical care. The American Association of Schools of Social Work was founded in 1919 with the purpose to facilitate communication among schools of social work.